What is a process? Consider an interventional radiology unit in a hospital that specializes in providing minimally invasive procedures using real-time advanced imaging techniques. If you consider this unit, you can take a view, for example, of a patient, and we can look at a Gantt chart that shows activities that are performed for the first patient who arrives at the unit. And you will see that the activities include registration, initial consultation, preparation of a room, then preparation of a patient, and then the actual procedure, then removing equipment, recovery, and consultation. And this is this Gantt chart, as you will see, all Gantt charts show on the horizontal axis the time, and on the vertical axis there are different types of activities or resources listed. So in this case, because we're focusing on one patient, we're showing different types of activities performed for this patient. If we look at another patient who arrived later, you might also observe that the patient is waiting after registration and initial consultation because perhaps the previous patient is still occupying the main resource of the unit. This view is a bit limited because it just looks from the perspective of a patient. And this is, of course, a very important perspective because if you are a patient, this is all you care about. But as operations managers, we need to have a view that looks more at the operations as the whole. So, for example, we might be more interested in a Gantt chart, which looks at multiple patients, right? And so here, some patients are only listed because perhaps other patients who did not show up, or perhaps they had to leave after initial consultation because they had some conditions that prevented them from having the actual procedure, right? So here you see another type of Gantt chart where the horizontal axis shows the full day of operation, and then the vertical axis, rather than showing activities, shows patients, flow units in this case, and and then some colors like black and gray are used to indicate when the actual activities are taking place and when there is waiting. So what is a process? A process is the act of creating value by transforming inputs into outputs using resources. In this case, inputs are patients with some kind of condition that makes them need the procedure. Outputs would be patients that are hopefully healthy, right, who have had the procedure done on them, and some condition that they had was healed. And resources would be, right, doctors, nurses, staff, so human resources, but also the space, the equipment, and may have perhaps some medication. In order to better understand processes, later on we will draw process flow diagrams, or PFD for short. Process flow diagrams that an example of which you see here. This is not for the interventional radiology, but just some small example. They include activities, which are these rectangular boxes, buffers, which are triangles, and decision points, where which we put in case a flow unit might follow a different path than another flow unit, and arrows that indicate where the flow unit is moving from one box to another. In order to understand processes, we will often define some kind of atomic unit for measuring flow. We will call it just a flow unit. In the case of interventional radiology unit, the natural flow unit is the patient.